question that is asked by very many people is, so bariatric surgery is same as stomach stapling. You must understand what is stapling. Stapling is an instrument or a device or a means that we use during surgery. So yes, stapling is used in almost all forms of bariatric surgery, be it a sleeve gastrectomy, be it a Roux-en-Y gastric bypass, be it a duodenal switch, etc., etc. So stomach stapling is not synonym with a bariatric surgery. So what is it? What are we actually going to do in this bariatric surgery? What are we going to do? So we are going to make your stomach small. Is this how bariatric surgery works? Yes, to some extent yes. So here I would want to define what are the different types of procedures that we see in bariatric surgery. So classically they were defined in two different types of procedures. Number one, a restrictive procedure. A restrictive procedure is a procedure which restricts the amount of food that you take in. And the other form of procedure is a malabsorptive. That means the food that you eat is not going to be assimilated or absorbed or metabolized wholesomely. So there is some sort of malabsorption added to the procedure. And of course there are variations wherein we have combined restrictive and malabsorptive procedures, right? So let's try to define what are the different procedures that we have. So largely procedures can also be a reversible procedure or a permanent procedure. So in terms of restrictive procedure or procedures that will restrict your food intake, we have a adjustable gastric banding, which is also reversible, and a laparoscopic sleeve gastrectomy, which is a irreversible process. In terms of malabsorptive procedures, there are n number of procedures. However, to make it very easy, there would be a classical Roux-en-Y gastric bypass. There is a mini gastric bypass, there is a duodenal switch, and there is a BPD with a duodenal switch. Largely one can understand these. And to add a more restrictive form in a malabsorptive form, that means, for example, in a classical restrictive procedure of a sleeve gastrectomy, over a period of time, the sleeve that we make or the tube that we make out of the stomach is going to dilate. To add another restrictive component, we can use a ring or a Phobie slit or a band, making it a banded sleeve. Similarly, we can also do a banded gastric bypass to increase the restrictive component of the malabsorptive or a combined procedure. So, defining it again, there could be sleeve and a band as a restrictive, and a combined, which would be a Roux-en-Y gastric bypass, a mini gastric bypass, and a BPD. So this forms the basis of the classification how we classify as bariatric procedures.